right, so we're back for another Lexington Learns, and this time I have Dave Tasto from Assisting Hands Home Healthcare. And Dave and I actually know each other from back at the Bedford Chamber of Commerce, serving on the board together. So it's nice to see you. I was very happy to see when I came over to Lexington that you are also a Lexington member.
That's right,
So
join.
we got to keep you. That's good.
Thank you, Aaron. Happy to be on today.
Oh, thank you very much. I'm glad. Assisting Hands, as I said, it's home health care.
Yep.
And I imagine with everything that's been going on, you guys are your frontline workers. So what changed under COVID with how you did your business, how you related to patients, et cetera?
Yeah, thanks. No, it was a concerning March. We weren't sure how things were going to go, but like a lot of other businesses, we had to adapt and move forward. As far as our clients, they are a population that is at significant risk.
Right.
So we had to take extra precautions. The certain staffing, I can get to that a little bit later, but basically we found other ways to connect with clients and their family members.
Okay.
One of the things that we really embraced significantly was our family portal, which actually provides insight to the family members after each shift. Our caregivers take their notes on their smartphones, and those notes are immediately available through our online secure family portal. So it kept, particularly for those family members who are minimizing their interactions and contact with their loved ones, our notes were there to still provide that insight to how things are going. Not just in a visual, because some folks would still do video calls, but observations after spending a little bit of time with their loved one. Found very helpful.
Yeah, I had no idea that the family portal was part of what you do. That sounds really helpful. I can imagine my parents are not in need of home assistance at this point, but they're in their 70s and they're in Texas. And so I can imagine if there were someone taking care of them, being able to go onto a portal at any time and see, what the latest was, would be very helpful.
Yeah, for remote family members, which is why we came out with it initially, but now it's even more important because of the minimizing interactions.
Right.
Yep.
Sure. And I'm impressed that you are able to. I wouldn't think with a high touch kind of service like this that you'd be able to do any kind of substitution with technology, but you have found a way to kind of fill the gap.
Assisting Hands, we do embrace technology to leverage it wherever possible. Even doing, sometimes we've offered certain clients virtual visits where we'll check on through a video call, as well as another way that we're just kind of figuring out how to do things new ways.
Yeah. Oh, that's excellent. No, that's really good. So this is probably a very good lead-in. What do people not know about home health care that might surprise them or that they should think about? Because I imagine it's the kind of service you don't think about too much until you need it, which is why I had no idea that there was such a thing as a family portal.
Yes.
So what do you find that people don't know about your business?
I think, as you mentioned, folks don't come into it until there's a crisis. I think I'm just increasing awareness about planning for aging in place. We've held some workshops at local senior centers to help families put together a plan of things that they can control, things that they can implement, or where they're going to need outside help. And home care or home health care is a piece of that plan to age in place. You might not need it now, but if you build those relationships, understand who you're going to be working with well ahead of the time, it can help streamline things significantly when the time does come. But as far as types of things that home care is or isn't, there's kind of, you mentioned home health care. Some folks think of home health care as more of a skilled nursing or therapy.
Okay.
And then home care, which is primarily what we're doing, is non-medical is the term, non-medical care. And that is primarily still certified nursing assistants or certified home health aides performing the support at home or caring for your loved ones, but more help with activities of daily living, help around the home, transportation needs, and so forth. Some of the things that we found very helpful these days is those types of things like errands or groceries or travel to and from appointments or whatever it might be needed, that would seem more of a concern for our population of clients that could see some more concerns in getting out and doing certain things.
Yeah, well, we've all come to rely more heavily on delivery services and things like that, people running errands
Mhm.
for us or bringing us food or medication or whatever. So it makes sense that that's something you guys incorporated.
Yeah.
So you mentioned, okay, so staying in home, in place, aging in place, that's the term you had.
Mhm.
You have a new book, I know, Thriving at Home. And so that seems like such a timely topic to me because, I mean, not only, yes, I know the population of the United States is aging and more people want to age in place at home, but when we're all stuck at home, thriving isn't the word that comes to most of our minds right now. Even my daughter, who's only 10, yesterday said, I've been stuck in my house for like
Right.
forever. Um, so, so tell me about thriving at home.
Thank you. No, it just came out this
Oh,
week, and
excellent.
yeah, just launched it, published it this week. We're excited that this week is actually Falls Prevention Awareness Week as well,
Okay.
and the book is aimed to help family caregivers support their loved ones and prevent hospital stays. It's a handbook for preventing hospital stays, and it's a resource and a handbook so that a lot of the things that our caregivers are doing on a daily basis, I've noticed, can also be and are being done by family caregivers these days.
Okay.
Particularly, early in March, where we had some clients that only had help once a week or so, did dial back on the care to minimize their interactions.
Sure.
And maybe that care then was provided by a family member. A family member may not have a certification like all of our aides have or the training. So the book and what I've seen through the spring and summer is if we can get the word out to educate and inform a lot of those family caregivers supporting their loved ones, we're just going to be bringing a lot better health and happiness to folks in their homes. Everybody wants to age in place, as as you brought up, as I spoke about earlier, the aging in place. You have to have a plan, but our support and through the thriving at home approach does give that ability to grant that wish about staying in your place, in your where you want to live during your retirement years.
Right. Um, what do you think? Can you give me an example, I guess, of something that might not spring to mind for a home care, a family caregiver, when they
Yeah.
find themselves confronted with this situation for the first time? What kind of advice do you have in thriving at home for that?
Thank you. It comes from making sure that your home is safe, and that's primarily all about falls prevention, as the number one reason for admissions in the first place in hospitals is from falls. And there's sobering statistics about how many folks fall every year, and many of those falls aren't, they don't cause major injury, but
Mhm.
others do cause significant, harm or injury, and require trips to the hospital. So we aren't saying that you shouldn't go to the hospital. There are many reasons why you would need to go to the hospital,
Right.
and often they're the best place for the right care that you need. But falls prevention is a big piece of it. But should your loved one have a chronic condition like COPD, diabetes, heart failure, or even a history of stroke, there's a lot of things that family caregivers can be doing at home. Not that they're going to be doing any skilled nursing or anything like that at home, but there's a lot of things to monitor for and things to support with at home that minimizes the symptoms or side effects or pain resulting from the symptoms.
Okay.
An example on diabetes is really just making sure that the blood sugar is taken on a regular basis, and then ensuring that the appropriate sugar up or monitoring sugar depending on the insulin or the sugar level is done properly and at the right time. As our clients sometimes lose their cognitive their strengths,
Yeah.
cognitive strengths, those tasks that are, more everyday to us, become more difficult. And so family members often start shouldering that burden, and everything we can do to help them along that path is going to keep their loved one happier and healthier at home.
Right. Was this book project something that you were already planning? You must have already been in the process of writing this, and then suddenly everyone's stuck at home. So I imagine you've had this book project in mind for a while. What made you want to write this?
I had the idea, primarily about all of the things that Assisting Hands and our team is doing to prevent hospital admissions,
Hmm.
or readmissions. We've been focused on that since day one. And as a fact, our national brand is focused on making sure that we keep folks happy and healthy at home. But the impetus for the book came from more just seeing some of the family members taking over the care and not necessarily having that education or background on what to do with their loved one to keep them healthier at
Yeah.
home.
Yeah. Oh, I'm sure that it's very helpful. So the audience for it is people who find themselves in the role of a caregiver, a family caregiver.
Exactly.
Yeah.
Yep. And it could be a spouse, it could be a son or daughter, or a granddaughter or son, that are the ones caring for their loved ones. But the thriving at home approach, as we talked about, earlier, in that we're doing everything we can to keep folks happy at home and healthy, is that we're supporting their independence. So the longer that they can stay doing more of what they want to do. So
Yeah.
we could come in and we could prepare full meals for them. But, if they can help cut up the vegetables, that's perfect. If we can keep them doing more of their everyday tasks, we
Hmm.
could bathe them, shower them, do all of the detailed personal care. But if they can reach around and put some soap and rub their hair and shampoo their hair, then let's keep them doing those kind of daily tasks so that they still maintain their independence and keep doing as much as they can do.
Oh,
That
that's great.
physical work also helps the cognitive, side as well.
Okay. I didn't know that.
Transitions I mentioned as well. If there is a need to go to the hospital, coming back out of the hospital or through a rehab to home is such a critical period, to prevent the return to the hospital.
Okay.
So we focus on making sure that those discharge plans are adhered to,
Hmm.
not because of, the folks don't adhere to them, not adhere to them because of they just don't care. It's just that they don't remember. They aren't certain things that they're
Right.
aware of or understand some of the instructions. So we can help with our nurse and social worker on staff that has the experience in transitioning folks from hospitals or rehabs. We can put those measures and those actions in place. And we develop a individualized care plan that's specific to each of our clients that our caregivers have access to and follow. And then we do supervisory visits to make sure.
So I know that this is, as we said earlier, this is a growing industry because the whole of the American population is gravitating grayer and grayer, as they say. Um, so what makes Assisting Hands unique in that niche of the market?
The focus on communication, as I mentioned earlier, in not just having an office team that supports the communications to families and the clients themselves, working on optimizing and matching. We're experts at matching caregivers to our clients. We've asked a
Okay.
ton of detailed questions about our clients at our initial assessment to develop the plan of care.
Mhm.
Not just what type of support do they need, but what are their interests, their personality, their hobbies, things that we will find opportunities to engage with them in.
Hmm.
So that the matching is a piece of it, but also uh, I mentioned the staffing and matching, but the communications to the family members,
Yeah.
after scheduling changes are made, but also those real-time updates as far as communications to and from and through the family portal.
Oh,
Uh,
no, that's all excellent. I know that there's also been, or in the past, I know that you have had staffing has been a challenge for you. Have you been able to to meet? I imagine there's been a surge because of the pandemic. So have you been able to meet the staffing challenge?
Yeah, recruiting has been a challenge this summer, but we have been fortunate in that our caregivers are speaking about us to their friends, and we've been able to get some referrals from caregivers through our caregivers. Um, One thing that we've been doing, just to, to get back to the question about differentiation,
Yeah.
training is a big deal. We've kind of institutionalized a national we're partnered with a national caregiver training firm, and so we're having little micro modules on our caregiver smartphones that they're able to get to that next level and kind of keep growing their skills. But the staffing has helped partially because I think it's how we take care of our team in that they are referring their friends. We partnered as well with a firm who does satisfaction management with us, and they interview 10% of our caregivers and 10% of our clients every month. And based on the caregiver feedback, they've compared those results to other home care firms in the area, and we rank at the top. So we've won an employer of choice in the Boston area from this firm, Home Care Pulse. In addition,
Congratulations.
for 2 years in a row now, we are actually also have been awarded a provider of choice in the Boston area based on that firm calling our clients and asking them, how is it working with Assisting Hands? I
That must be
believe,
very gratifying.
thank you. I believe it's because of how we start treating our caregivers that they're wearing smiles to work and happy to do what they're doing. That hard work on the front lines is a key piece to what they're doing. And when they're going to work happy, I think that helps a lot.
Well, I know that you haven't been doing this for a really long time. When I first met you, it was a couple of years ago, and you were just starting this business, if I recall
Mm-hmm.
correctly. I
Yep,
imagine
2 years
when
in
you
now.
Okay, so I imagine that you didn't go into it expecting that we were going to have a global pandemic um, right as you were ramping things up. Has this changed your perspective or your long-term outlook for the business?
Uh, in fact, I feel that the focus on care at home is actually even more prominent right now. We're hearing more and more these days about discharges right from hospitals to homes,
Hmm.
um, and kind of bypassing some of the rehabs or skilled nursing communities or facilities. And that demand, I believe, going forward for care in homes is just going to even uh, accelerate at a faster pace than it was already accelerating because of the demographics. But now I think even the demand for support at home is going to increase even more.
I would imagine. So you are assisting hands of Boston Northwest
Mhm.
suburbs, if I remember correctly. So what area do you encompass with that?
A large area north and west of Boston, basically from Route 9 uh, all the way out to 495
Uh,
and north up to Route 3, and
oh,
then all the way southeast to Winchester, Lexington.
so it's like a big wedge coming out of
Yeah, north and
the,
west. Yeah, basically everything
yeah.
north and west of the city. Yeah.
Okay. Do you have any plans for expansion?
Just last fall, we've added the areas down in Newton, Wellesley, Weston, all the way out to Framingham, Natick. So we did expand last fall.
Okay.
Yeah,
Congratulations on that.
thank you.
Probably just in time then. You must have staffed up just as all of this came pouring down.
Yeah.
Um, well, I thank you so much for talking with me. This has been very educational for me because it's not an industry that I know very much about. And I'm glad that
Mhm.
you took the time to educate me and Lexington Learns about it.
Uh, I'm very happy to be on the program. Thank you so much, Aaron, and great to be with you
So
again.
where can people get the book? Sorry, I didn't ask that. How does somebody get Thriving at Home if they want to get a copy?
Perfect. Now they can get a copy at thrivingathomehealth.com
Okay,
is the website for the book.
excellent.
We are located, our office is assistinghands.com
Mhm.
slash Boston NW.
Okay, so we can find you. I'll make sure I have the links so the people can find you when they want to get more resources.
Sounds great. Thank you so much, Aaron.
Absolutely. Thanks, Dave.